All right, Chapter 12, Fundamentals of Massage. Procedures for complete body massages. Ooh! Preparing the client for the massage. So two of the most common questions that clients will ask are, do I have to take my clothes off? And how much clothing do I have to take off? Yes, and all, please, or keep your underwear on. The best way to receive a thorough and complete massage is with all the clothes removed. If you are comfortable working on a naked human and your draping skills are top notch, explain this to the client. If you don't feel comfortable with them naked, tell them to keep their underwear on. Now, if they have extensive glute and low back issues, it is much easier to work on your booty and your low back without a barrier. So if you are comfortable, and you're in charge of your own session, if you don't want them to be nude, you can tell them that. But I would prefer nothing when I work on somebody. And explain to them why. And also explain to them that they are going to be covered. So some clients here may not feel comfortable taking off clothing. Explain why it's important and explain draping procedures. So if there is clothing that they keep on, you need to work around it. Like some people are uncomfortable and they keep their bra on. So what you can do is work around the bra, or when they flip on their stomach into a prone position, you can ask them if you can unclasp it so that you can get to their full back without having to stop. Sports bras are the devil when it comes to massage. But we'll have women that keep their sports bras on. A lot of it are the youth, and that's okay. It just explain to them in the future, maybe wear a normal bra so that there's more skin that I can focus on. It is a lot harder to work through clothes because we're automatically taking away all of our gliding techniques. Does that make sense? So kind of like a chair massage, when we're doing a chair massage, we're doing more percussion, more just kneading, and compression. So that's kind of the same thing goes with clothing. We can't do the glide, so it's a lot of kneading, compression, trigger point stuff, which we'll learn. But it is important to explain to them why you might want certain things off. And then tell them, I'm not going to be uncovering your torso at all until you turn on your belly and I uncover your back. So the only area being worked on is the only area I'm going to have uncovered. So you can explain that to them, especially if they've never had a massage or they're new to you, you can. So it's a nice, kind of routine to go over with your new clients. You can also put this in your policy form that they sign. If you have a website in the future, you can have a frequently asked questions section and have the undraping or what to wear during a massage question on there with the answer. All right. Also, before I forget, some people will leave their socks on. If they leave their socks on, they either don't want their feet worked on, they have no clue that they're supposed to take them off, or their feet are cold. So you can ask them, if you notice their socks, do you still want me to work on your feet? They'll say yes or no. If they say yes, you can say, do you want me to work over the sock, or do you want me to take these off or have you take them off? So some people will be like, oh, you can just take them off. It's really weird to take people's socks off. But sometimes it's easier for you to do that, for them to reach down naked or half naked to do that themselves.
That's pretty normal for me.
Take socks off?
We were just talking about how disgusting it is because the dry skin comes off with it.
Yeah, just like the dry skin just like poofs.
Disgusting.
Breathe this in.
Oh my god.
Weird aromatherapy. Draping. We already know what this means, but the book wants us to really know what it means. The process of using linens to keep your client covered while receiving a massage. This is like very important. Again, this book says we need to keep our temperature of our room 72 to 75 degrees. That's what is standard. I think that is a sauna.
I agree.
But if you see that question on the NBLEX, that's what it is. Linens, depending on what you like, you can do light cotton. I do microfiber because it's soft and affordable. You could do flannel blankets, fleece blankets, whatever you prefer. Heated table warmers are a nice luxury, and most clients will comment on how cozy the tables are because they're warm. So I recommend buying yourself a table warmer for when you are out and about doing your massages. Draping methods. So there's a couple draping methods that we will go over. Most of the time, you're just going to leave the room and your client is going to get on the table and you don't have to mess with any of this. Right? But sometimes you might have to help your client get on the table, and this is where these odd draping methods come into play. So when you're draping, you can use wraps, blankets, towels, whatever. They just need to be covered up. And depending on the service you're performing, like if you were to do body wraps or something like that, you will need to have better draping. Top cover method. And then there's the full sheet draping. So the difference between the two, and I'll show you guys. We'll actually pause this and I'll grab a sheet real quick. The top sheet method, you're just using the top sheet and folding it in a way. And then the other one, you're just wrapping around them like a cocoon. So let me pause this here. All right, assisting the client. So wraps can also be used. We have some in the school, and typically it'll just kind of look like a tube type of terry cloth or something like that. For guys, they can put it at their waist or, at the armpit like the women if they don't want their whole chest hanging out. Or you can have a wrap like this. Now, unless you're working at a spa where they're getting multiple services, you're not going to need to have this stuff. I do keep robes on the back of my door in case someone needs to go to another room. Like, we get people to do massage and facial together or massage and sauna. That way they don't have to get fully dressed to go to the next room. Or they need to use the bathroom in between. During their massage, they could just throw on a robe, go to the bathroom, and come back and get back on the table. If that happens, leave the room for them so they can get off the table and get their robe on. And then what I do, because I'm a crazy person, I go in there and fluff the sheets and kind of straighten them back out for them so that they have a clean table to kind of get back into. And it's easier if the sheets are nicely made and it's not like all wonky. All right, that's just what I do. Then I just wait for them outside of the door, close the door, and then let them get back on the table. All right, so if you do happen to use a terry cloth wrap, typically they Velcro on one side, so they're opened up and then they Velcro. Make sure the opening is on the side of the body, so when they lay, you can put another sheet over them and they can just unwrap that and they're laying on top of that with a sheet over them. Does that make sense? Hopefully. How to use a sheet, I just told you. Fold the bottom end up to the top, unfold to cover their legs. Some clients may need help getting on or off the table. So this is usually the older people or someone who's post-surgical. I've only ever had to help someone get off a table. I've never had to help them get on the table while they're like half naked. And I just hoist the little old ladies up. And if that does happen, you can kind of hold the sheet up like this as a barrier to kind of help them so they feel. Usually the older people are like, oh, I'm not modest. Well, I am. Like, I don't want to see it. So also if they happen to be all open for you to see, look away. All right, it's not proper to be staring at their goods, okay? But they might just feel comfortable because you're a professional. People, we're going to have so many good stories, or you're going to have so many good stories through the years. So preparing the massage room for your client. Make sure your table is made. All right, don't be making your table up for your client while they're in there. All right, they want to feel like, you are ready for them and that their time is important to you. So make sure the table's made. I tell my staff to do your table before you leave so that it is ready no matter what for the next person, or say there's another therapist using that room for some reason and they don't have to mess around with setting up the room because it's done. You just got to turn things on. So I also will unfold that top a little bit to encourage them to get in. You can even go get under the sheet and blanket. Still doesn't work sometimes. Instruct the client to undrape when you leave the room. You might want to throw that in there right away when you're telling your client. I usually say, I'll give you a few minutes, I'll leave the room and let you get undressed. If you don't say that, you got Chuck and Larry all getting their clothes off in front of you, unbuckling their belt, and I'm like, I'm going to have a heart attack. So make sure they are aware that you are going to give them private time to take their clothes off. All right? And then tell them how you want them on the table. Some of you might start prone, like I told you not to. Some of you will start supine. Maybe they can't lay flat, and some of you will start side lying. So you're going to want to instruct them on how you want them to lay. Then, once you're done with your little mini consultation, because you're also going to ask them what they want worked on and have a little powwow, see what your session's going to be like. Leave the room and wash your hands. Washing your hands should also be the last thing that you do before you go back in that room. So don't go wash your hands and then play on your phone, because phones are a cesspool for bacteria. Don't go and answer the phone, eat something. Make sure washing your hands is the last step, right? To prevent disease. And then not put your Cheeto dust on their face because you popped some Cheetos. So let them know, wash your hands. They'll just robe while you're doing that, and then you should be good. Usually I'll knock and be like, we good? You ready or whatever? Some of them will scream that they're ready throughout your spa, and you're like, oh my God. I have a friend who actually has a button that she lets them push, and it lights up a light outside of her door. I'm like, that is brilliant. But if that is you, make sure you sanitize the button between all your clients, right? Let's see. So as they're getting undressed, knock, make sure they're covered, because sometimes they're going back because they're turning their phone off, or they forgot to get the hair clip or something stupid, and they're like running back to the table like half naked, and it's weird. So make sure they are good when you enter. When the massage is complete, tap them and say they're done. No, I'm just kidding. Don't do that. When massage is complete, instruct your client to take a few minutes to get off the table and to get dressed, because they might be kind of dizzy from laying there, right? It's that euphoric, the dopamine, the serotonin rush. You are going to feel massage drunk. I'm sure you guys have felt that recently, right? As you're working on each other. Have you felt the full effect yet? No? You just got to be laying there longer, apparently. Whew, it's weird. You're like, can I drive? And it goes away quickly within 5-10 minutes. So that's the surge of endorphins. That's why massages are addicting. When you leave, tell them take their time, right? And then you leave the room. Wash your hands is the first thing you should do when you leave the room. This also means when you are cleaning up and wiping things, disinfecting them, wipe the handles after every client. Your door handle, because you've just touched that. They're touching it. You just got all their dead skin cells on that handle. Maybe they're coughing or sneezing in their hand, touching it. Nasty. Germs are gross.
So how many times do you vacuum your floor in the day?
The floor? Should I pause this? We have somebody if the floor gets gross, I'll vacuum it. But we have somebody, it's not a lot, every other week, deep clean the entire office. So you can run the vacuum more often. You can get a Roomba. Go ahead. But I do it as needed. If I notice it needs vacuumed again, I'll do it. I also will, I don't know, a couple times a year, deep clean the carpets. I hate carpet. I would rather have a floor that I can mop. But it's not my building. You know what I mean? So do what you feel. If you want to vacuum daily, do it. You just got to make sure you give yourself enough time. And if you're in a building, this is the main reason why we don't do it. If you're in a building with multiple practitioners, you cannot run a vacuum while they are in session. So that's why we just wait for a Sunday and we have somebody come and deep clean the office. Or you can get one of those little hand vacuums that are not powered that kind of just get the big debris up. Just judge it based on what you think is right. But yeah, carpets are disgusting. All right, positioning the clients on the massage table. So this is a picture of side lying position. I'll have to look when we're learning that. It's when we do the pregnancy or prenatal massage. So if you are positioning your client, make sure you have bolsters, right? Foam, cushions, pillows. Side lying position would be for pregnant women or people who can't lay flat. Sometimes you might have to use the massage chair, which we're going to learn how to use too. So make sure you always have a variety of cushions, pillows, bolsters, whatever, so that you can prop up a client and not have to send them away because you are stupid and don't have the proper equipment. You're not stupid. I'm just kidding. Ill prepared? So always have a bunch of pillows. Also, always have your pillows ready to go with a pillowcase. That's my advice. So that you're not with dirty hands touching a pillow that you can't wipe. You can actually I do like to get the pillow covers that zip that you can wipe in case you were to touch that pillow directly. If not, you can't really wash a pillow. You can, but you can. It's just, I'd rather just protect it with a covering anyhow. So make sure you have a variety. And then establish a sequence. This is why I gave you the picture of my tattooed man with crazy hair and a beard for you all to see. The sequence refers to the pattern or design of your massage. So you can begin either supine, prone, or side lying. Typically, your strokes go from light, then they increase to a deeper pressure. If the client doesn't want deep, they increase to a medium pressure, and then they lighten back up. So effleurage to 1, palpate and spread the lubricant. Deep to do the work that requires manipulation, and then you lighten back up as a relaxing type, so a feather stroking or whatever have you. So that's typically what you would do on each body part. So say you start with the head, touch some, I like to gently grab below the skull, right? And then you can kind of introduce touch. Or on a limb, you can do compression, start them off, light pressure to distribute the lotion, oil, whatever. Do your deeper work, and then lighten up with some nice strokes to finalize that area of the body. And typically, once you're done with an area of the body, you don't go back to it unless your client asks you, oh, can you do this a little longer? All right, so once I'm done with the arm, I'm done with the arm. All right? Because it's going to feel very choppy if you're bouncing around body parts. All right. Undrape the area. I feel like this is common sense at this point. Apply your lubricant. Massage. This is where you can do your joint movement, feather strokes, and then redrape. Timing. So this is the average timing that I like to do. roughly for a 60-minute massage, but I gave you your 50-minute massage time sequence. If you're doing an hour, typically on the head, neck, shoulder area, you're doing about 15 minutes. This is for a full body routine. On the arms and hands, it's about 10 to 15 minutes. So that's 5 to 7.5 minutes per arm and hand. Legs and feet, this is 15 to 20 minutes. Again, that is about 7.5 to 10 minutes on each leg, not each side of the leg. So say it's 10 minutes on each leg, that means you're 5 minutes on each side. Make sense? Kind of like this picture, 5 and 5, and then I turn them over 5 and 5. Yeah. And then 15, that allows 15 minutes on the back, because you'll see that most of it, neck, back, shoulders, and head, is half of your time allotted. That's because that is the main focus that most people want. So I want half of my time to be on that time. Now, say they don't really care and don't have a lot of neck and shoulders and back issues. You can kind of pull minutes or omit certain things, or pull minutes from maybe the head or the back and apply it to the limbs if they want more work there. So, but this is the basic that you can kind of start practicing based off of, and then pull minutes from certain areas as needed. When you're working on someone during your sequence, try to keep contact with your client at all times. It doesn't always happen, but they say even when adding your lubricants, try to keep a hand on them. For me, I can do that because I can pump, because I like to have the holsters with the pump, and I can get it in one hand. Obviously, as you're rubbing, you're not touching, but you can also keep a hand on them and rub. I don't do that because then they're feeling me rubbing weirdly, but if you can, try to keep contact most of the time with your client, especially when you're transitioning to different parts of the body. So a lot of times I'll cover the hand, and then I'll do a nice little stroke down the arm, and then next thing you know, I'm compressing the leg. So I'm keeping contact. So just kind of start practicing that to try to touch your client at all times or most of the times. This is a really quick one, a really quick lecture. The order of treatment. So I have the order of the treatment depending on, or if you start your client supine. If you start them prone, just reverse it. Okay? What I tend to do is you can start with breathing exercises to encourage them to relax, or meditation, or you can start it however you would like to. Some people get cymbals or a singing bowl and they'll chime something so that you know it's time. Or you can just go right into it, touch your client. My starting of the massage will be, as long as there's no allergies, a little mint oil on my hands, tell them to deep breathe, wipe it on the sheet, and then I start with under the head. So that's how I start. My clients kind of just know that this is how Bridget starts. At this point, you would do the face, the head, neck, and shoulders. So that's all one unit typically. All right. I like to start with remember the scalp, to distribute that oil that I may have put on, and to introduce touch, because scalp massages are so relaxing, and usually people will calm down then. And then you can go into the face if they want their face touched. Some people might not. All right. Neck and shoulders, and then you go into an arm. I am done with the neck and shoulders, so don't go back to it while they are face up, unless they request more time. So I do right arm and right hand. You can do left arm. Just remember that you're going around the body. All right, so if I start with this right arm here, the next thing I'm going to do is the left arm. You're not doing right arm, right leg. That's weird. So just try to pretend you're dividing the body up into top and bottom, and you're getting everything on the top, anterior first, and then going to the leg. So in this case, it would be right arm and hand, Then we're done with that. You're going to cover it back up. Some clients don't want it covered up, so if you notice the arms are already out of the sheet and blanket, you can say, do you want me to cover this up? They'll say yes or no. And then if they say no, say, if you get cold, feel free to just put your arm back under the blanket. So you're giving them that permission, because people act really weird sometimes in these situations where you're basically in control of the environment. Anyhow, so right arm, hand, left arm and hand, and then we're already on this side of the body, so might as well just go and do that leg and foot, and then end with the other side. Does that make sense? We're doing kind of a, in this case, a clockwise position movement. Then you turn them over. It doesn't matter, but I tend to start with the leg that I just did the front of the leg of. So say I just ended with their right leg, I flip them over and start with the back of their right leg. But it doesn't matter. It just, I feel like in my brain that works best because it's continuing that body part. That other leg is just on its own. It's been waiting a while. So again, when you turn them over, finish with the legs and then work your way up to the back and end on the back. It is very weird to do the front of the legs, turn them over, and then wait till the end to do the back of the legs. So just continue with the legs, for God's sakes. Please. So do that. You can also work on the feet in any position you want, depending on what's going on with the client. If they happen to have plantar fasciitis or an issue with their feet, I will actually save enough time where I work on their feet from both supine and prone position, just because I can get a better angle on the arch of the foot when I am pushing down with the weight while standing up myself. Anybody have questions about this? No?